Hello and welcome to the program this morning. I'm your host, Neil Howard, here on Health Professional Radio. Very glad that you could join us. I'm going to be in conversation for a few minutes with Dr. Ernest Isaacson. He's a board-certified podiatrist based out of New York City, and he's going to talk with us this morning about foot pain and injuries and how those injuries can lead to problems elsewhere in the body. Welcome to the program, Dr. Isaacson. Thanks for taking the time.
Thank you very much. Thanks for having me here.
A bit of background about yourself. I did mention that you were a board-certified podiatrist. Where do you practice in the New York City area?
So I practice in Manhattan. I've lived in Manhattan, and I have another office in the Bronx, which is a little further north.
Is podiatry what you always wanted to pursue in medical school, or did something happen to steer you toward that particular specialty?
I always wanted to be a doctor. I always, I'm kind of living the dream now, but I always had a yes to be a doctor. And I just wasn't really sure what I was going to do, but I kind of discovered podiatry in college. Almost everybody uses a doctor, and people generally do better from the stuff that I do.
Well, let's talk first about a problem with the feet that is very common with people that have diabetes. What is it particularly about the diabetic foot that is so problematic?
Well, the issue with diabetes is that it really there are many complications in the feet that happen from diabetes. And the two main areas that we worry about are the circulation and the sensation. So what happens is over time, the arteries can become somewhat occluded or clogged from the sugar. Mm-hmm. And that can lead to some devastating complications. So if you lose circulation, you really lose everything. But the more common complication that diabetics get is something called diabetic neuropathy, mm-hmm. Which is a metabolic breakdown in the nerves that lead to the feet. So it starts with a little bit of numbness in the toes. It can really lead to some pretty profound full-on numbness in the feet. When that happens, they're at high risk for things like open wounds, ulcers, sores, and, it's just the beginning of the horror story. And this is the reason why 70% of the non-traumatic amputations worldwide are done on diabetics, unfortunately. So, it's like anything else. It's simple prevention and, treatment and trying to treat the little problems when they're little and not letting them become big problems. Because obviously big problems are a lot bigger to treat.
With having no feeling or limited feeling in the foot, you don't know that you have an open wound or boil or any other problem with the foot until someone tells you, or until the problem becomes so bad that you can feel it where the nerves are more alive. Is that correct?
Right, exactly. And that's why, and I hate to say it, but it's the stupid things that'll get you, like anything else in life. And the most common reason for a foot ulcer or for an open wound in the foot is a tight shoe. So it's just something, and it just seems like it's something so silly. But, somebody who doesn't have proper sensation in the foot, they can't really feel anything. They can't feel when they step on something or when they have a large object in their shoe, like a staple or a tack. Mm-hmm. And, I mean, these are real-world stories. And so they develop a small open wound. They don't know it's there. It festers until it gets all the way down into the bone. And sometimes they don't know until their sugars are out of control, mm-hmm. or somebody else in the house notices the smell. And, I hate to be gory about it, but, these are real stories. And these are real stories that happen. And unfortunately, once you get infection into the bone, there's really, even in 2018, even with everything that we have, there's not really a good substitute for removing the infected bone.
Wow.
And that's where the horror stories start. So, and, it's simple prevention. It's having them in every 3 months, shaving their calluses, checking their nails, and just looking at the foot and educating. It's like anything else in medicine. It's the simple stuff. It's so easy to do.
Mm-hmm. Now, when it comes to diabetes, how can you tell that your patient has diabetes? How is it tested, and are there different levels of diabetes?
Sure. So not every diabetic will have manifestations in the foot. And not every diabetic is going to develop complications. So generally, when patients come to me, they've already been diagnosed with diabetes. Occasionally, somebody will come to me that has, real manifestations in the foot that has never just been diagnosed, but for some reason they just haven't been to a doctor, and that's happened. But usually, it's the typical symptoms. So somebody who is, let's say, going to the bathroom a lot, very hungry, very thirsty, if the diabetes is really severe, I mean, you can actually, people can pass out from diabetic ketoacidosis, which is a severe complication of very high sugar. But, typically people are getting symptoms. And just to be clear, there are two types of diabetes. Type 1 diabetes, which is what people think of as more juvenile diabetes, where the body stops making insulin And then there's the type 2 diabetes, which is 90% of diabetics in the U.S., which is where the body is not as sensitive to insulin. So that's more of an insidious onset. It comes on a little more slowly. There are simple blood tests that will test for high sugar levels, and there are other more sophisticated blood tests that will actually measure the amount of elevated blood sugar over a 3-month period, which is known as the hemoglobin A1C. So it's easily tested. It's easily tested in any doctor's office.
So obviously, a person who's been diagnosed properly with diabetes should pay a lot more attention to their foot, as should their healthcare provider. But we all stand on our feet. We all use our feet to do just about everything. Athletics, dancing, just walking to the store or walking across a room. What about a person that doesn't have diabetes, but they're having problems with their feet? What are, I guess, the main foot problems in a person who's non-diabetic?
One of the more common things that I see, and you mentioned people who are standing for a long time. So if you haven't had it, somebody who has it, is there's a heel pain condition called plantar fasciitis, or heel spurs, which is just a strain of the plantar fascia, which is a tight band of tissue that originates in the heel, typically first thing in the morning. And that's, if you're standing a long time, or even not standing a long time, and you're standing in shoes that may not quite be as supportive as they could be, then it's very common to develop this type of heel pain. It's also very treatable, and a lot of what I do is just sort of common sense, just looking at the problem and figuring out a solution that works for people. So somebody's not getting the proper support. If you get better support, either from a better shoe or something called an orthotic, which is a custom-made arch support, then it can go a long way. If you're just creating a better foundation for the foot and going up the chain for, the hips, the knees, the back. And I don't treat back pain per se, but I have had many patients who come to me with back pain, and once you get a better alignment and better support for their feet, then other problems seem to resolve as well.
Now, you mentioned poorly fitting shoes being of concern to folks with diabetes. I'm assuming that poorly fitting shoes would be a problem for anybody, especially someone who's athletic, say a runner, someone who's involved in jogging, marathons. There's a condition known as, runner's foot. What exactly is that?
Yeah. There are a number of lower extremity conditions that can affect the foot. There's a top 5, actually, of lower extremity running conditions that affect when you go down from the knee. So chondromalacia patella, which is also a form of runner's knee. There's iliotibial band syndrome, shin splints, Achilles tendonitis, and plantar fasciitis. So all of those sort of run into the category of runner's foot. Now, I run, so one thing that I don't do generally with my runners is tell them to stop running, because I happen to be of the mindset that running is actually good for the feet and good for the knees and everything else. But we can talk more about that. I can't emphasize enough how important it is to get a decent shoe that works for the foot and that has a good wear pattern. Shoes have a life expectancy of about 250 to 500 miles, and I've had patients come to me who are runners who have foot pain, and they say, maybe it's time to get new shoes. And I say, how long have you had the shoe for? And they say, about 2 years now. And that's a lot of mileage. And it's a new shoe can really make a big difference. And a decent fitting shoe, a properly fitting shoe, because I'm a podiatrist, I'll say it, ideally with an orthotic in there. I love the idea of a custom-made foot orthotic inside the running shoe. I think it's a great combination, and it's what I run in myself, and so I hold my patients to that standard as well.
What about kids? They're developing. They love to run around barefoot indoors and outdoors, and they're changing shoe size frequently until they, stop growing, for lack of a better term. What can we as parents do to ensure good foot health, not only in the child, but into their adult years as well?
So it's a good question. As a father of 7, I tend to be a little more relaxed with kids. I see a lot of children, and I have a lot of parents that bring the kids to me either for, what we would call flat foot deformities, or like an in-toeing deformity, or they're concerned about the way they're walking. I tend to be of the mindset of being a little more relaxed, because a lot of these foot deformities that you see in kids, even though they may look like they're horrible and look like something that, this kid is just never going to develop out of this, most of these things will resolve. And I do believe that kids' feet need to sort of develop the way that they need to develop. So in other words, I tend to be a little bit more conservative in treating them. I do orthotics for kids. I do a lot of inserts. But my feeling is, as far as shoes for kids and as far as treating kids' feet, and as far as kids going barefoot, I actually think that, little kids' feet do better barefoot. Just letting them develop and sort of, contacting the ground and developing. And over time, as things become a little more formed and a little more rigid, for example, the arch forms around 7 or 8 years of age. And before that, kids are usually pretty flat-footed. Those kids generally, they have a lot of cushioning. Their feet are really plastic. They can adapt to the ground really well. I tend to just let them do their thing, let the foot do its thing in relation to the ground, and let them run around a little bit. Those kids, for the most part, will do okay. Once in a while, I see a kid that, I'll see something developing that I just don't like, and will intervene and, maybe get them a little more, and then get them to treatment or therapy or a brace or an orthotic. But for the most part, kids' feet need to just develop. And so my advice to parents is get a shoe that fits the foot well. Don't worry as much about the support, and let that foot just do its thing and let it develop a little bit. And as long as if that kid's old enough to complain, as long as he or she is not complaining, then generally it's okay.
Now, I know we've only scratched the surface of good foot health. Where can we go online and learn some more? I understand you have a web presence.
So I do have a website. Thank you for that. It's www.drisaacson.com or nycfootdoc.com. There are a few national organizations as well. There's our national body is the American Podiatric Medical Association. They have a lot of good information on their website, so it's apma.org. And there's also the American College of Foot and Ankle Surgeons is our governing surgical body. They also have a lot of good information out there. And to be frank, WebMD is not a bad resource. They are generally pretty vetted, and there's a lot of good stuff out there. Internet information, medical information is always something to be taken with a little bit of a grain of salt, like anything else.
Absolutely.
So you have to take it as sort of a guideline. And, if you have a good friendly local podiatrist that you trust, then you can confirm the information with them. But like any other information, I mean, you want to use it as somewhat of a general guideline and just make sure that you're getting the information vetted and confirmed and verified.
Ernest, I appreciate you coming in and talking with us today, and I'm hoping I'll talk to you again in the future.
Yeah, it's been my pleasure. Thank you so much, Neil.
Great. You've been listening to Health Professional Radio. I'm your host, Neil Howard, in conversation with Dr. Ernest Isaacson about podiatry. Transcripts and audio of this program are available at healthprofessionalradio.com.au and also at hpr.fm. You can subscribe to this podcast on iTunes, listen in, and download at SoundCloud, and be sure and visit our affiliates page at hpr.fm.
Thank you for listening to Health Professional Radio. We're very proud to be an independent broadcaster providing our content free of charge to you, the listener. One of the ways that we're able to remain free and independent is by having people like you become patrons. You can support Health Professional Radio simply by visiting hpr.fm and clicking the button that says Become a Patron. Your patronage of even just $1 a month lets us know that you're there, which in turn makes us more valuable to advertisers. And, of course, if you're able to afford more, then we would certainly appreciate the support. My name is Toby Longhurst from Health Professional Radio. Please visit hpr.fm, click the Become a Patron button, and support us if you can.